Okay, hello everyone, welcome back. I talked about in the previous video about the chronic hepatitis. Right now I'm going to talk about the acute hepatitis on the perspective of the liver function tests. So this is a liver function result. The first one is the WBCs. It's normal. Hemoglobin normal, platelet count is normal, everything just in the CBC is normal. What about the albumin? Albumin is as well normal, 4.5, which is normal. Total bilirubin, direct bilirubin. Um, the total is not abnormal, direct abnormal. So there's basically a biphasic increase on both direct and indirect. So that gives us an indication that the problem in the liver. Um, okay, let's continue. The AST and ALT. Oh my gosh, marked increase, more than tenfold. Acute hepatitis. In the previous video, we've talked about the chronic ones, and we found out that there's less than fivefold, right? But here is more than tenfold. That acute hepatitis, so AST and ALT, more than tenfold. That's an acute hepatitis. Okay, let's see, just 5,700, and the normal is 0 to 35. The ALT 6,200, the normal value is 0 to 35, which is so increased. This is tremendous increase, basically. Okay, what about the ALP? It's going to be just normal, okay? There's no obstruction. ALP and GGT is concerned with the gallbladder obstruction, but in this case we don't have a gallbladder obstruction, we have an acute hepatitis, which is a problem in the liver, so that makes sense. Okay, just here's a progressive increase in both just in total bilirubin and BT, progressive destruction of liver function, markedly elevated liver enzymes that indicate acute hepatitis then start to decline, indicating consumption of these enzymes with massive hepatocyte necrosis. So basically, you gotta notice here, this is the total bilirubin, AST, ALT, alkaline phosphatase, and PT. Notice here is so huge elevation of those enzymes. But once you got to the third day, there's just sort of decrease, right? And that gives us an indication that, okay, there's something to mention here. The acute hepatitis, at first place, we're gonna notice so increase on those liver enzymes, but once the time has passed, we're gonna notice there's a decrease in those liver enzymes. What is the reason? Because those enzymes, or the virus, is destructing the liver, and there's some sort of necrosis on the liver, so there's no production anymore of those enzymes that is related to the liver. So this is something have to be appreciated here. Okay, what is the diagnosis of this case according to the given ALFTs? Acute hepatitis for sure because of AST and ALT, and on the just next or just the passing days we notice here that there's a decrease, so this is a good indication of an acute hepatitis. What is the most likely cause of jaundice in this patient? Hepatitis E. Okay, I forgot to read the scenario, but just the most important here, he has come back from Malaysia, where he had a vacation there. So basically it is hepatitis A, where mostly affects the travelers. So hepatitis A, and it's sort of acute. It doesn't come with chronic ones, so this is another thing that we have to appreciate as well. Hepatitis A is never come with the chronic ones or chronic condition. Hepatitis A affects travelers, affects it comes only in the acute status, not in the chronic ones. So yeah, viral hepatitis common hepatitis A. what are the needed investigations to confirm the diagnosis? Viral markers, right? Because we need the viral markers to confirm or exclude whether it is hepatitis or not. Okay, the only way that makes us like think about or diagnose the hepatitis viruses by the viral markers. Okay, and in this case we have just the most important is for AGM anti-HAV antibodies, detection of AGM any anti-HAV antibodies confirms an acute or recent hepatitis A infection in patients without symptoms. AGM any anti-HAV antibodies suggest a prior infection. Okay, without symptoms, but once it is with symptoms, it's an acute. Okay, prior infection or an asymptomatic infection, which is more common in young children. Well, an IgM infection always going to be an acute status, right? We can as well check for hepatitis B surface antigen, IgM, hepatitis B core antibodies, hepatitis C antibodies, because we don't want to exclude anything, but in this case, most likely it is caused by hepatitis A virus, right? So we're gonna focus upon the hepatitis A IgM. Because once it is there in the serum, that's a confirm or just we could make a diagnosis of hepatitis A virus. How can we how can you explain the changes in day 2 and 3 in LFTs, acute stage and ongoing pathological process? So because it got decreased, it doesn't mean that it is just the infection has been gone. Not at all. This it could mean like it is acute hepatitis. Because the liver enzymes have been destroyed. So this is something that like super important to know. Okay, just to recap what we've said. The most important thing is once there is a biphasic increase on the bilirubin, that indicates a problem in the liver. And once those enzymes are super elevated, they are super high elevated, that gives us an indication that it is an acute infection. Because in the previous case, we've talked about the chronic ones, and there were the bilirubin, both of them are elevated, and the AST and ILT, both of them are elevated, but they are not so high elevated, they were mild elevated, so the diagnosis was acute hepatitis, but here the diagnosis is a chronic hepatitis because of, I'm sorry, oh my gosh, I just confused. Okay, just because of these are so high elevated, it's an acute one. The previous one, there were a mild increase on the enzymes, though that was a chronic case, right? But here is an acute one. Biphasic, it means the problem in the liver, and just super high elevation, it means that it is an acute hepatitis. It is most likely. And because of the scenario, he was in Malaysia, that gives us like there's a hepatitis A virus. So with that being said, I hope that you enjoyed that and did benefit from. Thank you.